So, oh, one other thing is gout. So this is old picture, someone with gout, and it just hurts like crazy. It feels like somebody's just tons of pain in that joint. Happened a lot of times with big toe, especially you're often due to chronic kidney disease. You have accumulation of uric acid in the joint, and the two bones just grind against each other with this crystals of uric acid in there, and just hurts like crazy. So things like chronic kidney disease, hypertension, alcoholism, obesity. Being male also is a risk factor for this. And you have hemolysis, which is breakdown of red blood cells. Extreme exercise sometimes does it, and also some other disorders like Lesch-9 syndrome and myeloproliferative disorders also are a risk factor in developing gout. Next slide. So here's what happens in gout, and you have the joint space mineralizes. You have this uric acid in there, it mineralizes, and so the joints don't move easily, and you have this big old swelling on the side of the foot. You can see that. You can see that right there. And you can see a mineralization, so it becomes more opaque in an X-ray. Opaqueness means that there's more stuff there, so that's why bones show up better, because they're denser than skin, and so the X-rays show the bones better. Next slide. Okay, so here's gout inflammation in the olecrational bursa. So normally this should be about like this, but this is huge. So you got this big old bump on the end of your elbow there. Next slide. And what happens is in gout, you get this uric acid in there and inflammation of soft tissue, and then you get what's called rat bite erosions. Those are late in the game, but there's one there. Sorry, you can see that rat bite, like a rat took a bite out of your toe, out of the bone, and here you can really see this one. So it's very obvious there on that right panel. So it just chewed out that whole section of bone, is just gone. Next slide. So, all right, so we got models of knee joint, and we'll identify the ligaments and that kind of stuff. That's the I'll do some separate videos for those and actually show you those. So let's see if we got anything else. Next slide. And we'll also look at the hip, shoulder, and elbow. Next slide. So I'm going to go through them real quick just to point out some things. So this is the hip joint. You have the ligament of the head of the femur, so that holds the head of the femur into the acetabulum there, and this attaches on the femur at the fovea, meaning small depression, capitis. So that's the fovea capitis, is actually that spot right there on the femur. So, and let's see. That's all. It just shows the same kind of things. You have a joint cavity, or articular capsule. You have the articular cartilage. All that stuff is just the other things that are shown there. And then here we have the ilium. Then we have the ligaments. We have iliofemoral ligament here and here. We have the greater trochanter of the femur here, and we have the pubofemoral ligament here coming across here. Pubic bone, and then here's the femur here. So the head of femur is stuck up, goes up, and is inside there, like that. Okay, next slide. So here's the showing the ligament of the head of the femur right there, and the articular cartilage on the head of the femur, as well as inside the joint capsule. You also have the labrum. The labrum is actually, in the acetabulum, so you have articular cartilage inside there, and the femur slides around inside there with its articular cartilage, but you also, to keep it from popping out, you have a little bit of labrum around the outside, which is made of fibrocartilage. So that helps hold the head of the femur in there. Next slide. Here's a section through the femur. So you have the head of the femur, you have this have the femur there. And you have space, the joint space. And so this is the acetabulum part there. And you can see a little bit of the acetabular labrum. It's just a little edge right there. Because this is all articular cartilage there. That's articular cartilage there. So it's just so you have the articular cartilage like that, and then you have the little bit of labrum on the outside. So sometimes you get those labral tears that have to be fixed or cut off, so it reduces the pain. Next slide. And here's when you have a hip replacement. So you're replacing actually the head of the femur. So you replace the ball. Then you also put a plastic socket in the acetabulum, put some cement to hold it in place, and then you have a replacement ball for the head of the femur. And then you take your femur, so you still got a lot of bone, but this metal device is fitted inside the femur, and it's cemented in place to hold it there. So that's a total hip replacement there. Next slide. Shoulder joint, you have several structures here. So you have the tendon of the long head of the biceps brachii muscle. So there's your biceps muscle. And you have a tendon that comes all the way up here. So this is the tendon. This right here, the blue part, is the tendon sheath. So there's a sheath around a tendon, and the sheath is like a bursa. So there's liquid on the inside. So there's basically synovial fluid on the inside, so the tendon can slide back and forth and doesn't rub against things. Then underneath the acromion, here's the acromion here, and then you have the coracoid process, and you have a ligament going across. And then between this tendon, this tendinous sheath for the biceps tendon coming across the top here, you notice it went through the greater and lesser, the groove, the sulcus, but here's the lesser tubercle, and here's the greater tubercle of the humerus. And so there's that groove, that sulcus right there, where the tendon sheath goes up and over. And then so between the acromion up here and this tendon here, you have a bursa right here. So subacromial bursa. And I had a friend who they went and they gave her a shot. They gave her, and the nurse missed and went right into there instead of into the muscle, which would have been the deltoid muscle, which would be a little bit lower. So she just missed and hit that and destroyed the bursa. So she's really not happy about that. So anyway, then you have articular cartilage on the head of the femur there, and you have the joint cavity there, and this is a scapula here. Oops, point there. Let's see, synovial membrane, you see that in the fibrous layer of the articular capsule. That would go all the way around this whole thing. Let's see. I think that's it for the shoulder joint. Next slide. So, for that parts of it. So, is there anything else I want to show you on here? I guess the other part. So you have all these ligaments and everything that are holding the joint together. If you look on the top left of the anterior view of the articular capsule, you have all these ligaments in white that are holding it together. You have two bursa. There's the subacromial bursa and the subscapular bursa there. There's the tendon sheath over the tendon of the long head of the biceps brachii muscle. You have all these different ligaments holding this thing in, but those ligaments aren't enough, and so what we also have are, look on the right side, the anterior view, we have several muscles. There are 4 muscles that hold it together, and these are called the rotator cuff. Okay, so there's 3 muscles that you see on this side. We have the supraspinatus, we have the infraspinatus, and we have the teres minor there. And then this is the anterior view, so here's your subscapularis. So supraspinatus, infraspinatus, teres minor, and subscapularis, those are all the rotator cuff muscles. and the tendons associated with those that all attach to the humerus. And there's the tendon for the subscapularis muscle. So those provide also support. Those also provide support for the shoulder, and they help hold the head of the humerus into that glenoid cavity, where the socket for the ball or the head of the humerus. Next slide. So, okay, so right shoulder, I think that's pretty much it. They're just showing the glenoid cavity here. You can see that. I'm looking at the left side over here, and there's also an edge here. You have the labrum, so there's a little bit of fibrocartilage there around the side of that too. So you can tear that labrum as well. So sometimes you have a labral tear in the hip or a labral tear in the shoulder. And okay, next slide. So that's just showing the shoulder joint frontal section. So you have the scapula, and then you have your the head of the humerus, and you see the articular cartilage there. You see the acromion of the scapula is up here. And then you would have the supraspinatus muscle, subscapularis, also showing two of the muscles there coming across, making part 4 muscles of the rotator cuff. And then here's the glenoid capsule or cavity there. The head of humerus fits into. So, next slide. All right, elbow joint. Getting close to the end. So we have the humerus up here, and then we have the ulna and the radius. That's the anterior view, so we're looking at this from the front. And so this is the trochlea there, and the capitulum. So the radius nestles in with the capitulum, and the ulna goes around the trochlea. So you have various ligaments that go around this joint. Let's see. I'm going to talk about I'll point out the radiocollateral ligament and the annular ligament here, and the ulnar side is there's an ulnar collateral ligament. So there's those 3 main ligaments that are holding this joint together. There's another ligament that's not really shown on this view, and this view here is I'm trying to figure out how that's set up. So they've got if this is the right arm, then the hand is pointing down. I think about that one a little bit. So it looks backwards. Anyway, I'm going to think about this one a little bit. So sorry to buzz out on you there for a second. So we have the trochlea of the humerus and the olecranon. So you can see how the olecranon goes around the trochlea here. So the elbow goes up and down like that. And you have a little olecranal bursa here on the outside to prevent the elbow from rubbing against the skin there, so that you don't have friction there. Next slide. And here's the this elbow joint in it's a frontal section. So it's a little bit offset kind of view, but you're looking at the trochlear notch here, the trochlea, and then the head of the radius, and there would be the capitulum would be sticking out just right there. So it's that, and here's the radial notch in the head of the ulna, showing here's your articular fibrous capsule around the outside of that joint. Next slide.